Constipation. That is right. That is by far the most common symptoms my patients complain about when I start them on iron tablets for an iron deficiency anemia. That is right. Now, guys, it's not to say that you're going to get constipation or you have constipation if you're on iron, but I see a lot of patients with constipation. There are other potential symptoms that iron tablets can cause as well. I'm going to tell you about what those are. But let me go back very quickly to the constipation bit. First of all, there are things we can do about that, okay? So don't stop your iron tablets if your doctor has advised them because you have constipation. Talk to us about that. We can help you with that. But I'm also saying this to know that if this is you, you're not alone. And sometimes, like I'll be honest with you, in the same breath that I'm prescribing iron tablets to my patients, I'm also warning them about potential constipation because that's how common it can happen. So just know you're not alone. Talk to your doctor. But today we are talking specifically not just about iron tablets, but how to take your iron tablets so that they are the most effective. Guys, there's actually a right and a wrong way to take your iron tablets. I'm going to tell you what that is. Why do we use iron tablets? You might be asking. Well, for iron deficiency anemia primarily. That is, if you've got low blood counts due to low iron levels. That can be for a multitude of reasons. I mean, I often see women who have fibroids and may have heavy menstrual periods. That's a common cause of iron deficiency anemia. Let me know, by the way, if that's you. That's many people. Or maybe you're losing blood from somewhere else in your body. Maybe you have an underlying medical condition that makes it hard for you to absorb iron. Gosh, there's a whole list of reasons why you might have iron deficiency anemia and why your doctor might have prescribed iron. But back to the point of this video is there's a right and a wrong way to take your iron tablet. By the way, you should check with your doctor about what they want you to do. I just want to give you some general information about iron to know what to talk to your doctor about. So what do you need to know? First thing, you should be taking iron on an empty stomach. That is right. To help maximize absorption of that iron into your body, it's best when taken on an empty stomach. And in particular, when it comes to foods, there are specific foods that really iron should be taken separately from, in particular. So calcium-containing foods and beverages, things like milk, calcium supplements, cereals, dietary fiber, tea, coffee, eggs, things like this and other calcium-containing foods, you really need to be separating from your iron tablet to maximize the absorption of your iron. Also, iron tablets tend to be most effective when your stomach is mildly acidic. So I know you're probably saying, well, what in the world does that mean? What that means is that if you take a medication to lower the acid in your stomach, like an antacid, a histamine blocker, a proton pump inhibitor, okay? Those can actually be problematic when taking your iron tablets. So what does that mean? It means that your iron tablets really should be given 2 hours before or 4 hours after you taking any antacids, okay? Because once again, iron supplements tend to work best when in an acidic environment. So we want to separate those antacids. Also, there are many doctors out there that recommend that their patients take iron tablets along with vitamin C or with orange juice or something like that to increase iron absorption. I would say that studies and data is a bit mixed on this. There's some studies that say it doesn't really make a difference, doesn't really help, but some doctors prefer it. So you want to follow your doctor's advice about what they advise with regards to taking vitamin C or a vitamin C product along with the iron. Now, let's go back to the side effects because I opened this video by talking about the constipation, which by the way can be pretty tough. But there are also other symptoms. You guys, you probably know about this. You can get flatulence, you can get stomach cramping. Some people get diarrhea. They may feel a little funny in their tummy in general. Some people get nauseous and have vomiting. Some people also get a metallic taste from their iron tablets. So these things can be distressing. And the stools, your stools could be changed as well. Some people get black or dark green stools. You definitely want to be talking to your doctor about any stool changes you have, but also know that stool changes can happen with iron tablets. Regardless of whether you think your stool changes are due to iron or not, talk to your doctor about this because we are always, always, always interested in knowing about stool because, by the way, if your stool is changing, it can be for a reason that's not so healthy, not so good. So let your doctor help you figure out what any stool changes are due to. So just keep some of those things in mind, guys. Biggest thing here is just remember, iron really should not be taken with food, and some of the other guidelines I mentioned. Make sure you talk to your doctor about how best to take your iron tablets. Also in the prescription that you receive, there usually is some instructions. Pharmacists are amazing. They are our friends, okay? Remember to talk to your doctor about any side effects that you're having. Don't stop any medications without talking to us, because often we can help if you have any side effects. Remember, this is just sort of some general information for you to take back to your doctor. Your doctor is you. As much as I might want to be your doctor, I am not, unfortunately. Make sure you're talking to your doctor about what's best for you. But understanding that iron tablets are so important, even life-saving for so many people for so many different reasons. So want to make sure we're taking these right and correctly. Guys, let me know in the comments if you take iron tablets. Feel free in the comments. This is a safe space, and oftentimes I find that what you write in the comments actually helps other people who are reading and watching behind you. So I want to thank you guys in advance. I'm Dr. Jen Caudle, practicing family physician, on-air health expert and video creator. I do daily videos. You guys know this. Make sure you subscribe to my Facebook page. I do daily videos there and everywhere. For those of you who send stars on Facebook, thank you so much in advance. Also, consider joining my exclusive subscription groups, Dr. Jen Superstars. You get private lives, all sorts of stuff on YouTube. Hello, y'all. Love y'all. Love y'all too. Please subscribe to my channel. Click the little bell for updates. And guys, make sure you go to drjencaudle.com. I do a free health newsletter that comes out every week. Also, you can sign up for my daily health tips. That's an exclusive service where you can get daily, like, little tips in your inbox every single day. Oh my God, I love them. Hope you love them too. Anyway, guys, I love y'all. Hope you're well. Bye.